Segment is sponsored by Ward MD and Form Derm Spa. I am here visiting with Dr. Ward with Ward MD. Doctor, great to see you. Thanks for being here.
Thank you.
Okay, I have a question for you. Somebody in their 30s is walking in to your office and, asking for certain things or feeling like they need a little refresh versus someone in their 60s. You kind of see everyone, right? Of all ages.
Right. Well, I like to think of that. I think it was Benjamin Franklin who said, an ounce of prevention is worth a pound of cure.
Ooh.
So that 20-year-old, 30-year-old who's coming in, the focus is going to be much, much more on how do we prevent things versus the 60-year-olds like, okay, how are we treating what's already happened? How are we treating the effects of gravity? Whereas with the 20 or 30-year-olds, like, how can we prevent some of those effects from happening?
Yeah, that's
so
very
the
true.
discussion totally changes on who we see.
Do you feel like it is worth it to start in your 20s and your 30s because it does make a big difference once you're turning 50, 60, 70?
Oh, for sure. Like, the difference is astronomical. Like someone who, even something as simple as wearing their sunscreen daily makes a huge dramatic difference in terms of the facial aging that they'll see. So getting started on medical grade skincare is a huge changer. Another one that probably the next step up would be getting started on just kind of regular skincare routine, whether that's like hydrofacials where you're getting your face kind of cleansed and cleaned out regularly, maybe semi-annual chemical peels or laser peels.
Okay.
And then the next step above that would be things like Botox. Botox works by weakening the muscles. Our wrinkles form from muscle contraction. So, these crow's feet that I've got around my eyes are showing up because over the 46 years, 47 years of my life, I've been kind of doing this so often. And eventually, my skin creases just like a piece of paper would crease if you fold it enough times. By using some Botox there, you're going to prevent that from occurring. So again, the 60-year-old versus the 20 or 30-year-old, we're going to talk like, hey, let's just do a little dose of Botox here. Not that we are worried about your wrinkles.
Sure.
But we're going to prevent them when you're 40, 50, 60 from being as severe.
That's a really good point. I often think you might not wonder, in your 20s if you're needing Botox, but it is something that can prevent you later on from needing more work.
Right.
Now, someone walking in your office that's maybe in their 50s, 60s, 70s, what are they mostly asking for? What are they looking for? So,
it's highly variable. It might be something as seemingly silly as like, oh my gosh, I've always had prominent ears. Like I'm finally at a point, my kids are out of the house, I want to get it fixed. It's always bothered me. I can't wear my hair a certain way. But more commonly, it's things like droopy eyelids, eyelid bags, or, in our 40s is where we really start to notice it, where cheeks start to sag, our jawline starts to get a little saggy, we get some kind of hanging stuff here, and we don't want that. We want a nice, tight jawline. And so we can do that. So in the 50s, 60s, that's really when getting those elements of the face that have started to show age is when people want to address those.
Sure. Okay, so in our 20s, we should look at doing lots of sunscreen, maybe a little bit starting a skincare routine.
Right.
And then you can maybe advance to Botox, and that will all prevent you later on from having to do much more work.
For sure. All about prevention. And then the other things that younger people do are things like, well, gosh, my cheeks aren't very big. And that's making me look a little less, pleasant or a little less feminine or a little less masculine.
Sure.
So let's add some volume here. Let's reshape the jawline. That's something that more and more young people are doing because surgery just isn't for the older people.
We're seeing that a lot. I feel like on social media, I'm seeing a lot of the jawline.
Right. Or the other thing is, we all have those friends who are thin, right? But it looks like they have a double chin. Like doing this procedure that I do with, it's a deep neck lift where we're actually addressing some of these deeper structures here to give them that nice defined jawline. You don't have to live like all your 40s and, through your 40s and 50s with this kind of double chin look.
That's very true. You don't have to. And it's nice that you have those options. You can go to the website on your screen for more information to schedule that consult or go to the Q card or make it easy for you. Dr. Ward, great to see you. Thank you so much.
Thank you.